As Ontario continues to grapple with the strain on hospitals, Premier Doug Ford was in Moncton today, meeting with the premiers of Nova Scotia, New Brunswick and PEI. All Conservative premiers who say they too are dealing with a struggling healthcare system.
The status quo is not working here in Canada, right across the country.
It's not just Doug Ford saying that.
The status quo is just not acceptable anymore.
Call it a crisis or significant challenges, whatever the words you want to use.
Long waits in ERs and for surgeries, a shortage of healthcare workers. They are problems each premier agreed are occurring in their provinces. While the problem was identified, the solution was not.
This is a Team Canada approach.
Last week, the Ford government released its plan to ease the pressure on hospitals and confirmed it was considering expanding publicly funded surgeries in private clinics. New Brunswick Premier Blaine Higgs didn't rule that out as an option either.
Everything is a possibility in relation to how do we improve healthcare.
Ford's government also says it will speed up accreditation for foreign-trained nurses. Prior to this meeting, he met with Federal Intergovernmental Affairs Minister Dominic LeBlanc. The premiers have long been calling on the feds to increase transfer payments for healthcare.
He wants to work with us.
At Queen's Park, though, the opposition was not impressed.
He can meet with Minister LeBlanc, but the fundamental problem we have in Ontario is that we spend the least per capita of any jurisdiction in this country.
Another way the Ford government is attempting to ease pressure on hospitals is with new legislation that will allow health officials to move hundreds of people who are waiting for a long-term care bed into one that is immediately available, even if it's away from their community. The Minister of Long-Term Care insists no one will be moved without their consent.
It is very clear what the legislation does. It allows us to look at where does a patient who's been discharged, what are their preferred homes? If that's not available, what other homes might be around that area? And does the home, the additional homes, do they have the services that that patient needs?
It says in the legislation there will be no use of restraints for people who don't want to go. But will you use another stick to make them go if they don't want to go? Like, would their families be charged daily for the hospital bill? Because we know that that has happened or has been threatened in the past. Is that an option?
Look, I think that's been an option since 1979. That's not part of this bill.
Liberal MPP Adil Shamji, a former ER physician, acknowledges people who need a long-term care bed are not getting the right care in hospital, but adds,
that does not mean that we start forcibly moving people out of hospital.
Now, the Minister of Long-Term Care says once the new legislation is passed, and it will be with the majority government, the guidelines on how far away a patient can be moved will be released within a week. So we'll get a better sense of how this will impact families and their patients. One more note, another hospital today announced it has to close its ER this evening, St. Mary's Memorial in Perth.